Good morning. As of yesterday, Baltimore City has 16,531 reported cases, 99 people hospitalized with COVID-19, and we're at 454 deaths. I'm up here every week to ensure our residents have the most up-to-date and accurate information so they in turn can make smart and informed decisions for themselves and their families. We remain focused on continuing to scale up our response to this emergency to ensure residents of our city have the resources and support that they need at this time, while continuing to leverage the wealth of medical and public health expertise right here in Baltimore City. I want to remind residents of the invaluable resources available at coronavirus.baltimorecity.gov, and that's coronavirus.baltimorecity.gov. And today our health commissioner will be outlining some updates to our dashboard. There, residents can find real-time data for Baltimore City as well as locations for where they can get tested. We are still in a pandemic, one that's built to spread rapidly in large groups. The corona pandemic hasn't gone anywhere, but we know what we need to do. Wear a face mask when out in public, watch your distance to others, and wash your hands often. We have been very successful throughout this pandemic in avoiding large outbreaks. But we are coming to a time of year where the risks are going to increase. The weather will be colder, and people will want to spend more time together indoors. We need to be even more vigilant to keep our loved ones and our neighbors from getting sick and dying. We are continuing to hold off on permitting large events to keep crowds low and reduce the possibility of super spreader events from happening here in Baltimore City. Indoor and outdoor gatherings remain capped at 25% of the fire code rated maximum occupancy of a venue. If the venue does not have a fire code rated maximum occupancy, the cap is 25 people. I'm continuing to work with Health Commissioner DeRosa and our public health experts to review data and determine when it will be safe to further loosen restrictions or, if needed, tighten them back up. We're continuing to prevent deaths and life-altering illness by making decisions based on the data. Again, I want to thank the majority of Baltimoreans who have heeded the warnings and followed the guidance. And as always, we will continue to monitor the data daily. Also, remember to get your flu shot. I'll say that again. Also remember to get your flu shot. Because I have pre-existing conditions, I have already got my flu shot this year, and I encourage all Baltimoreans to do the same. Don't take chances with your life or your families. Get your flu shots today. And in most places, they are free. Now I will ask Baltimore City Health Commissioner Letitia DeRosa to update you on our COVID response and how we are supporting residents and their families in our city.
Good morning, and thank you, Mayor Young, for your continued leadership during this health crisis. Briefly, I'd like to give a few updates related to the coronavirus pandemic. Unfortunately, we're seeing the number of new cases increase, and we now have a 30% higher daily new case count than we had a month ago. Our current number of new cases per 100,000 people is 12.5, up from 9.6 about a month prior, and above the state's overall average. While our positivity rate continues to go down, we are here to remind everyone to continue to seek COVID-19 testing at either one of our mobile testing sites across the city or at a clinical site. Testing is vital in the following cases: if you believe you have been exposed to a confirmed case of COVID-19, or if you have experienced any symptoms of COVID-19, including fever, chills, cough, shortness of breath, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion, runny nose, diarrhea, vomiting, or nausea. Or if you've been going out frequently and have been in close contact with others outside of your home, please get tested. For more information on where to get tested, please go to our website, coronavirus.baltimorecity.gov. People with coronavirus who may not yet be showing symptoms can unknowingly infect others. If you're concerned you may have contracted coronavirus, even if you don't have symptoms, please get tested to ensure your peace of mind or to determine if isolation is needed. As we approach the holiday season, beginning with Halloween at the end of this month, I would like to once again remind residents about harm reduction in an active pandemic. First, traditional trick-or-treating, indoor Halloween parties, and indoor haunted houses are not advisable this year and present an elevated risk of disease transmission. Second, wearing a costume mask does not count as wearing a face covering to limit the spread of disease. I would not advise wearing both. Instead, wear your normal protective face covering over your nose and mouth, or decorate your protective face covering for Halloween. If you are planning on celebrating on Halloween, please remember our harm reduction rules. Be sure to maintain social distancing of at least 6 feet from non-household members. This includes anyone outside of your home, and please wear your cloth face covering over your nose and mouth when out. We know that activities like singing, yelling, and in this case screaming, can lead to more droplets being spread in the air and an increased risk of coronavirus transmission. So please remain vigilant this Halloween. Now that we are in flu season, I would also like to take this time to announce our Flu Vaccine is Worth It campaign launching today. We know that the flu vaccine is safe, reliable, and reduces the chances of serious illness from the seasonal flu. We also know that the threat of the twindemic, a severe flu season coinciding with the surge in novel coronavirus cases, presents a real risk in straining our hospital care systems. While a safe and effective vaccine for the coronavirus is still being developed, we have a flu vaccine now. We need residents to do everything in their power to stay safe this year, and that includes getting a flu vaccine. We have set a goal of 70% of all Baltimore City residents getting their flu vaccine this year. Visit our website, health.baltimorecity.gov/flu, to find out where you can get your flu shot. Additionally, we will be scheduling vaccine clinics for our older adults and at community sites across the city, with details to be listed on our flu website. Be on the lookout for our Flu Vaccine is Worth It advertisements on social media and around Baltimore City in the weeks to come. While the pandemic continues on, the health department continues to focus our efforts and attention on other major public health challenges, including HIV. Our infectious disease team has created a plan aimed to end the HIV epidemic in the United States by 2030. Announced in February 2019, Baltimore City's draft Ending the HIV Epidemic Plan was developed over the past year through an intense community engagement and listening tour process. Our goal here in Baltimore, in line with the federal mandate, is to achieve 75% reduction in new HIV infections by 2025 and a 90% reduction in new HIV infections by 2030. Our plan is currently open for public comment until October 31st via the website www.endhivbaltimore.com. I encourage all stakeholders, including every city resident and every city agency, to review the plan and submit your feedback. Lastly, I'd like to remind all Baltimore City residents to continue to socially distance when around those not in your household. Please wear a cloth face covering over your nose and mouth when in public spaces, and wash your hands frequently. Continued practicing of these protective measures will reduce transmission of both COVID-19 and the flu in our city. Thank you.
Thank you, Dr. DeRosa. Next, as you all know, we have had a 3-alarm fire Sunday night in Northwest Baltimore. Initially, we had 5 residents taken to the hospital in serious condition. Today, 3 have been released and 2 remain in serious condition. I've asked Chief Niles Ford of the Baltimore City Fire Department to come and provide an update on the situation. Chief Ford.
Thank you, Mayor. Shortly before 10:30 p.m. Sunday night, we responded to the 2800 block of Virginia Avenue for a reported fire. Upon arrival, our firefighters noticed visible fire showing from multiple occupied homes. After having 2 homes collapse and fire spreading to approximately 5 other residences, the incident commander struck out a 3rd alarm for additional resources. Although it has yet been confirmed, some residents stated that they heard a loud noise, which they said resembled an explosion. There were a total of 5 victims taken to the hospital in serious condition, 3 adults and 2 children. At this time, 1 adult and the 2 children have been discharged from the hospital and are recovering at home. And as Mayor Young mentioned, the 2 other adults remain in the hospital in serious condition. Throughout the night, our firefighters worked tirelessly into the early morning to extinguish the fire and to ensure that additional fires did not flare up, and also to protect the residents and the community. In conjunction with the fire department, the Office of Emergency Management worked with the Baltimore City Fire Department, DHCD, and the Red Cross to establish temporary shelter for displaced residents. It's because of the overwhelming support from our partnering agencies, that we were able to use Edgecombe Circle Elementary School as a donation site and a warm place for displaced residents to receive food and water. At this time, the cause remains under investigation, and we are praying for a full recovery for the 2 victims who remain in the hospital. Thank you, Mayor.
Thank you, Chief Ford. And I want to thank all the men and women of the Baltimore City Fire Department, all of our external partners, and all city agencies that were there to help coordinate the response that was needed to help our residents. And a big thank you to Red Cross, who once again showed up asking how they can help. Finally, today, I'm excited to have Verizon, who would have been here, to announce the launch of their 5G network in Baltimore City. This marks a huge leap forward in this new era of technology and innovation. Baltimore continues to be at the forefront of providing technology that residents will benefit from now and in the future. Our partnership with Verizon will continue to grow as 5G technology is spread across the entire city, and residents will see improvement in wireless speed and overall coverage. This is a win-win deal and a game changer for residents and visitors in Baltimore City. Unfortunately, Eric Reed, Vice President, Entertainment and Tech Policy for Verizon, was unable to join us today, but he did send a statement which I will read now. We are thrilled to name Baltimore as our first 5G city in the state of Maryland. The partnership with the city and its residents and the investments that we are making in Baltimore today marks a continuation of what we started earlier this year in February. We announced 5G innovation learning schools at Baltimore Design School, Graceland Park O'Donnell, Hollerberg Academy Elementary and Middle School, Vanguard Collegiate Middle School, and Walter P. Carter Elementary and Middle School, providing students and teachers with a tablet device, a 4-year data plan, and STEM-based curriculum. These technology tools will provide students with an immersive learning experience. This is an important opportunity to prepare Baltimore students for the jobs of tomorrow, leveraging the power of technology to enhance student learning. In March, we announced the Tech Workforce Training Initiative in partnership with the Ministers' Conference of Baltimore and vicinity. This relationship allows Verizon to work with community organizations that are supporting programs to increase digital inclusion and tech training that would enable reskilling and upskilling opportunities for job seekers looking to work in new industries. Our 5G investment in Baltimore will drive ultra-fast speeds and allow consumers to download and stream content in seconds. Particularly during this pandemic, the ability for small businesses to seamlessly conduct contactless transactions with their customers or students and teachers having enhanced connections to collaborate together on homework assignments are just a couple of many examples that 5G enhanced capabilities will further digital inclusion in our Baltimore communities. Mayor Young, I am sorry that I could not join you in person today, but thank you for your partnership and continued leadership as we work together to advance Baltimore as a technology champion that is creating a brighter future for our young residents and businesses. Thank you, Eric, and thank you, Verizon. With so many residents, and especially our students, working virtually at this time, I know this will be a huge impact. Thank you and stay safe.